Amanda here to talk to you today about the DSM-5 diagnoses and the whole text and chapter on anxiety disorders. So for anxiety, we treat people with antidepressants, SSRIs, and benzodiazepines. These affect the gamma aminobutyric acid, which slows down the central nervous system, creating a state of relaxation in the body. In my previous video on depression, I talked about antidepressants and SSRIs, how that triggers serotonin in the brain that can increase mood, energy, so on and so forth. We use standard testing when working with anxiety disorders, as well as the client will be doing a lot of self-monitoring, what's going on at home. We also use group support as a form of treatment for anxiety. So it's really important that the family gets involved here to help people with anxiety with their coping skills. That's going to be a really big tool to help them get past their anxiety and panic attacks. What I have found as a professional working in the field for over 2 years now is that 80 to 90% of my clients have a mental health disorder, especially anxiety, due to a medical condition or some sort of trauma that's happened in their life. The few that aren't are either born with the mental condition or are genetically predisposed to it, such as bipolar or autism spectrum disorder. So even if you're genetically predisposed to mental health disorders, medical accidents and more traumas actually increase the mental health condition, adding new diagnoses and symptoms to be treated, if not treated as soon as possible, because if they're not treated as soon as possible, the symptoms will rise and the condition will worsen. So as soon as that trauma happens or as soon as that incident happens, it's best to go see a professional to help get back to that state of homeostasis, and if you can't, to find a new state of homeostasis that you feel at peace and can get back into flow with your life. If we avoid them or turn away from them, that darkness is going to pull deeper, 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 and it's going to get deeper rooted and harder to work with or look at in the future. So the sooner we can shed some light on the symptoms, then the faster and easier it will be to get help. In the diagnoses listed, I have not included all of the diagnostic criteria, so if you are trying to find everything, please again consult a professional. If you do resemble some of the symptoms or resemble some of the diagnoses, seek a professional for help. Do not self-diagnose, as there are a lot of different contributors that make up these diagnoses. So please, if you're ever concerned about anything, call a professional. The first disorder under anxiety disorders is separation anxiety. This is an inappropriate and excessive fear or anxiety concerning separation from those who the individual is attached. Persistent worry about harm can occur to them. Persistent or excessive worry about an untold event that causes separation from the attachment figure, such as being killed in a car accident or kidnapped. Refusal to go to school or work. Persistent refusal or fear about being alone without the attachment figure. Refusal to sleep away or be without the attachment figure at home. Repeated nightmares with the theme of separation, and repeated complaints of physical symptoms when separated from the attachment figure. This lasts for 4 weeks in children and adolescents, and typically 6 months or more in adults. This also causes clinically significant distress in the individual's daily functioning. Selective mutism disorder. This is a consistent failure to speak when expected to, such as in school, despite speaking in front of others. The disturbance interferes with educational and occupational involvement, and it lasts for at least 1 month. Specific phobia is a marked fear or anxiety about a specific object or situation, such as flying, heights, or animals. It's involved with intense fear or anxiety. The fear is out of proportion with actual danger, lasting 6 months or more. Social anxiety disorder, or social phobia, is a marked fear or anxiety or one or more situations in which the individual is exposed to the scrutiny of others, being observed, performing in front of others, or meeting unfamiliar people. The individual fears that they will act in a way or show anxiety symptoms that they will be negatively evaluated. Social situations are avoided or endured with intense fear and anxiety. The fear is out of proportion with the actual threat and lasts for 6 months or more. There is a specifier for this one that is performance only, where they only feel the fear and anxiety in a performance state, but the fear does not occur outside of the performing art. Panic disorder is a recurrent, unexpected sequence of panic attacks. The panic attack is an abrupt surge of intense fear or discomfort that reaches a peak within minutes, and during which time 4 more symptoms occur. Accelerated heart rate, sweating, trembling, shortness of breath, feeling of choking, chest pain, nausea, dizzy, lightheaded, faint, chills or heat sensations, numbness, fear of losing control, or fear of dying. At least one attack has been followed by 1 month or more of one or both, persistent concern or worry about additional panic attacks, and a significant change in behavior in order to avoid future attacks, not attributed to a substance or explained by another mental disorder. Agoraphobia is fear or anxiety about 2 or more of the following: using public transportation, being in open spaces, being in enclosed spaces, standing in line in a crowd, or being outside of the home alone. Individual avoids or fears these situations because of thought of escape might be difficult, or help might not be available in the event of a developing panic attack. Or another embarrassing symptom might occur, like falling or incontinence. Agoraphobic situations almost always produce fear. Agoraphobic situations are actively avoided. Fear or anxiety is out of proportion with actual danger. Fear, anxiety, or avoidance is persistent for at least 6 months. Generalized anxiety disorder. Excessive worry or anxiety occurring most days for at least 6 months about a number of events, activities happening in someone's daily functioning life, such as at work or at school. The individual finds it too difficult to control worry. Anxiety and worry are associated with 3 or more of the following 6 symptoms. Only one is needed in children: restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbance such as restlessness. Symptoms cause clinically significant distress in daily life, not attributed to side effects of a substance or another mental disorder. One thing that I have found that doctors could be doing better at is finding out exactly if the individual has tried to control their worry or not. Are doctors taking the precautions to educate on how to control anxiety and worry, such as looking at the person's lifestyle, their nutrition, and even their relationship dynamics to find out more? I will be doing further videos on this in the future to also help all of us become more of a whole person by identifying what those aspects are in our lives in order to change up some of those perceptions or activities to lead a more stress-free lifestyle. There are substance medication-induced anxiety disorder. Panic attacks or anxiety are predominant in the clinical picture. Evidence of panic attack during or soon after substance intoxication or withdrawal, or after exposure to a medication. The involved substance is capable of producing panic attack symptoms. not better explained by another medical condition or mental disorder. It does not occur during delirium and also causes clinically significant distress in their daily lives. Some of the disorders that they have listed in the DSM-5 are alcohol, caffeine, cannabis, hallucinogens, inhalants, opiates, sedatives, amphetamines, cocaine, and others. Our final anxiety disorders are anxiety disorder due to another medical disorder, such as having panic attacks after evidence of direct consequence of a medical condition and not explained by another mental disorder. There is also other specified and unspecified anxiety disorders. So if you followed along during the whole video here, you'll be able to see, even though I didn't state, all of these disorders cause clinically significant distress in the person's daily life, as well as last 6 months or more for most diagnoses, and it is not attributed to another mental condition, substance use disorder, or other unknown. So at the end of each of these diagnoses, there's something that we call a differential diagnosis. These are diagnoses that are similar to the diagnosis of that specific disorder, however, a little bit different. So we can cross-analyze what the individual's symptoms are to be able to diagnose them appropriately and to get them the right treatment. So with some of these disorders, you're going to have different forms of therapy for some of them. For instance, someone with social anxiety might need a more exposure therapy. Someone with agoraphobia might need to work with cognitive behavioral therapy to work on those negative thoughts and those irrational thoughts. So again, we're trained in all the different modalities, therapies. Some therapists find that they fit better with certain modalities, whereas others don't. So all of the diagnoses are an interplay of different therapies. So we're constantly putting in a little bit of the different modalities, which with each individual when we're doing our treatment, so that they can get the whole picture encompassed here for what the individual's needs are. And it's always going to be a little bit different each session, because every time someone comes in, they're dealing with something different each time, different stressors. So there's always something to be working on with that. So if you guys have any comments or questions or concerns or resources, or want more information on any one specific disorder, please comment below and I can go further into that and provide resources on that in my next videos to come. I will be doing lifestyle, nutrition, and yoga for anxiety next, so that we can work on that whole person philosophy and find out what are some of the things that we can do as individuals to reduce our anxiety and to help our friends. So look forward for those videos to come up, and I will see you next time.